A part of my research also entailed on looking at patients with lysosomal storage disease. It was a rare disease, and I sat in one of the lectures where a geneticist gave a lecture about this particular disease, and because of my physiology background, I was very intrigued by it. And I sat in a lecture where they said that these patients with Fabry disease do not have any visual problems. They have these unique deposits on the front of the eye, cornea, and they are very useful diagnostically to identify the patient. However, they do not actually affect the vision of the patient. And so that was very surprising to me, because how can you have deposits in the front of your eye and it not mask your vision? And that was very surprising. I fundamentally started with the question saying, do patients with this rare genetic disease have visual problems? There were at least 15 papers that said no, and so I started with an open question saying, I'll just survey them and see if they have a problem. It was obvious that they had many eye problems, including one of them was inability to see in dark very well and have glare problems from headlights in the car, etc. In fact, some of the patients said that they've stopped driving at nighttime because of these problems. It is very important to save a person's life, but I think the quality of life is also very important. And them having difficulty in nighttime driving and vision issues is a quality of life issue. So there are drugs, and medical doctors do amazing at keeping patients alive, but the quality of life was poor. So I further ventured into it, and the present study, we looked at their vision, of particularly contrast vision, and we compared them to healthy age-matched controls, and what we found was their vision was declined in all spatial frequencies. And let me explain that. So when you look at any object, when you look at the black and white chart on your in your eye exam, you are examining mostly the high spatial frequencies. But if you look around you, none of the targets are looking like black and white objects. They look in all different shades of gray. And so real life vision requires a different kind of testing called contrast sensitivity, which is seldom done in clinic because of time issues, etc. And what we find in the lower spatial frequencies, essentially identifying gray letters on a black background, where the contrast is so minimal, their vision is quite poor. And this is compared to healthy age-matched controls of their own age. And this is very exciting, because what it says is that the contrast vision in all lower spatial frequencies is low, but when it gets to visual acuity, they will be fine. And so the doctor, if they only tested visual acuity in the clinic, they will never get the true cause of their problem. Next steps is that if they have these deposits on their cornea and they have decreased contrast vision, it is very likely that they will have glare problems at nighttime, as patients are complaining. And our next step would be to quantify these glare issues and see how much glare issues these patients have. Once we figure out these two issues, there still remains one more issue. Patients also have a dry eye in Fabry disease, or at least complain of it, and looks like it is more of a systemic issue. They don't sweat very well, the patients with Fabry disease. They also don't tear. They don't produce tears very well. So that will be another issue that we will be researching. And then eventually, once we get answers to all three questions and we have quantified their contrast sensitivity, their glare, and their dryness, then we would go into therapeutic modalities to either give them lenses or filters that can help them see better during daytime and nighttime, and maybe even treat their dry eye issue. Right now, if some patient of Fabry is watching this, you can certainly meet your doctor and express to them that you have vision problems, and particularly the nighttime, and the doctor could evaluate it and maybe prescribe you appropriate lenses to help you. I do not have the answer which exact lens or filter will help you, but we could try multiple varieties, so individually patients can try that. The interesting part of the Fabry disease is that we have seen classic textbook pictures of beautiful deposits on the cornea that you can actually diagnose the patient. And in reality, after seeing 100 plus patients with this disease, what I have found is the presentation's anything but textbook. And so these are very subtle, they are very different, and I'm hoping to come up with a publication that will clarify this issue, that the deposits on the cornea can be very subtle. And the lag in diagnosis is too much. But the patient presents with issues or problems at age 13, and they get diagnosed, or 9 to 13, somewhere there, 9 years of age or 13 years of age, they get diagnosed with a disease almost 20 years later. So there's a huge lag in diagnosis, and so eye care professionals, ophthalmologists and optometrists would really benefit if they paid a little closer attention when they find these symptoms, vague symptoms, and look at the front and understand that the deposits can be very subtle.